COVID-19 deaths are linked to the Kirkland Life Care Center. Today, family members of people treated there held a press conference outside the facility demanding more support for the staff and better communication. For example, today one woman told us she got a call that her mother had passed away. Then just hours later, another call saying she was doing just fine.
And I said, that's bull. My mother died at 3:30 this morning, and she was shocked and regretful, and apparently the nurse that had called me, she was swamped. She was giving meds, she was doing temperatures, she was trying to deal with the coroner and everybody else to help get my mom out, and she somehow neglected to get all the information in the chart.
Now, on Wednesday, we learned the head of the Federal Centers for Medicare and Medicaid Services said they're sending inspectors along with experts from the CDC to determine whether the nursing facility followed guidelines for preventing infections. Today, I interviewed the president of Life Care Centers of America, which operates the Life Care Center in Kirkland. He says the Kirkland staff is so busy. Employees of the Life Care at the headquarters in Tennessee are calling families on a daily basis to update them about their loved one's health. He says the Tennessee employees read the information entered by a nurse in Kirkland, and in this case, the computer file was not updated to say that the patient had died.
From the moment I heard it, I was very, very disturbed that that would happen to one of our residents and a family member. So I called the daughter of the woman who passed away to tell her how profoundly sorry I was that this had occurred. I'm a mama's boy, and when I lost my mother, I know how painful that is. And so I could understand something that she was going through. But we had a very nice conversation, and I said over and over again how sorry I was, but I also told her that her experience would allow us to keep this from happening again.
I also asked him about the federal investigation at Life Care Center of Kirkland and the multiple family claims of inadequate care or communication.
So we welcome the Washington State Department of Health and the CDC to be in our facility. We are eager to take any advice, any instruction, how whatever assistance they can offer. Well, we would hope that people understand that we're doing our best to serve the people who are in the facility. You know, for the world at large, we're in uncharted waters when it comes to this coronavirus. We're trying to find our way as we deal with and try to understand how to deal with this disease, and it's our hope that science can proceed to find the right antidote for it.
And finally, I asked him what he thought about Governor Inslee's statement this morning that it's a possibility the government could step in here. And he says they are using the best medical advice they have to care for their patients, and they're reaching out to the best infection control people in the nation seeking their advice. Meanwhile, family members of the patients at the Kirkland facility, they want to see more support for the staff there and more timely information.
While we believe that the Life Care Center has been ineffective, we do not believe that they are to blame. They should never have been left to deal with this outbreak unsupported. If this facility is safe enough for my father-in-law, I want Mike Pence in that facility. I want Dow Constantine's. Any of them who have elderly parents, I want their parents in this facility. If it's safe enough for my father-in-law, it's safe enough for their parents as well.
Well, ultimately, the family members had nothing but kind things to say about the staff that's actually at Life Care Center. They just want to see more support for this facility, more being done for the patients there, and of course, better communication, as they said.
They have a right to have that.